guess what we can do is we'll go ahead and start some introductions. Hello, everybody. And we are coming to you today from our new office in the Blount County Public Library. So, yay, we were actually able to get set up and everything there. So we're not holding regular office hours here right now. However, if you need something, if you want to meet, we are able to do that here now, and we can definitely direct you to the right place. So my name is Amanda Engel-Linsky, and I'm a grant coordinator for Be Aware Blount.
I'm Carly Crawford, and I'm also a grant coordinator for Be Aware Blount.
And if we want to just go around, and if you can introduce yourself and tell us what sector you're coming from or who you're with, that would be great.
I'll go ahead. I'm James McMillan. I'm with the education sector.
I'm Katie Doherty. I'm with Helen Ross McNabb Center in Blount County.
Hi, Katie.
I'm Lisa Atkinson. I'm with the United Way of Blount County.
Hi, Lisa.
Hello.
I'm Heather Ledbetter. I'm Maryville City Schools Coordinated School Health Coordinator.
Hi, Heather.
Hey.
All right. Well, we're going to go ahead. We have a shorter agenda today, so we'll kind of get it going. And as people pop in, or if they do, we can let them introduce themselves. First thing we want to talk about is our pickup day in the park. We had that in December, the very end of December. We had some pretty decent turnout for that, especially since it was the weekend right before Christmas, which we knew was going to be tricky for a lot of people. But we ended up collecting a full bag of trash and then 1 pound of cigarettes and cigarette butts from our playgrounds. And so that wasn't throughout the whole park, that was from our playgrounds specifically, which was pretty concerning given the fact that there's not supposed to be any smoking in the playground. So that was in Springbrook. That was a collaboration with Keep Blount Beautiful. And we are looking to do another pickup event in the spring when the weather might be a little more accommodating, and hopefully people will feel like getting out and helping out with that a little bit too. So that's a good thing for us because not only does it obviously clean up our parks, but the data that we collect from that is important as we look to write new grants in the future. So yeah, that was a successful event for us.
Yeah, and it was nice too because we were able to keep our distance and stay safe from COVID and stuff like that too. So it was just a good way to kind of get out of the house and do something for the community, and then also it helps us. So
and the kids were pretty involved. We had several kids that showed up, which was nice because they were able to, we recorded them talking a little bit about how surprised they were that there was so much smoking going on in our playgrounds and why that was concerning. So that was a good day, I think, all around.
Definitely. All right, everyone's favorite topic, fundraising. So pretty exciting. We actually have an angel donor through the end of January. And so they are matching all donations through the end of the month, which is great because a $25 donation is a $50 donation this month. And so every little bit helps us as we're now our own 501c3 and we're managing our own finances. And so if you or anyone that you know would be interested in donating, you can go to our website, which is on the screen, but it's just beawareblount.org. There's a donation section. You can also donate through our Facebook or set up a fundraiser for Be Aware Blount if you are interested in doing something like that. We also have a Scentsy Party going. Angie Pass is a local community member, and she was kind enough to start a Scentsy Party for us. And so all of the proceeds from this fundraiser will go directly to us. That can be accessed. There's an event page on our website or on our Facebook. It's also, there's a link on the screen. And so if you're interested in stocking up on any of your Scentsy products, that's a great way to support us. And then, so we kind of have a question for you guys. Amanda and I have actually both ordered this sweatshirt, and we thought it was fun. And so we ordered it through Custom Ink, and basically they will actually set up a fundraiser for you. And so um, basically they were saying, like, if 9 people order this sweatshirt, they will go ahead and fulfill the order, and then anything from that point on is just like a profit for us. And so we were wondering what everyone's thoughts on something like that would be. Like, would you personally be interested? Do you think people that you know would be interested? We're basically just looking for some feedback before we invest a lot of time into this.
And we have to get to 9 purchases, which doesn't really, it's really not that high of a number. We've bought the sweatshirts. They're super warm and good quality and all of that, but we just want to make sure that there's an actual interest before we kind of
promote that.
Yeah.
So if anyone has any thoughts on that, feel free to let us know.
Time for comments.
Yeah.
How much are they?
I think we priced them at $35.
That's what we would need to make kind of a decent profit out of it, running it as a fundraiser.
Yeah, I think if you do it as a fundraiser, more people would buy it than probably would just having it as an item in your like shop on the website or on Facebook. Because like even like at the beginning of the pandemic, Pokies did something and it was better together, 6 feet apart. And like, and I think the donation, I think whatever proceeds they got, they donated to United Way, but I wouldn't have bought one, but that it was a fundraiser. So I've got a lot of shirts that if it wasn't for fundraising, I probably wouldn't own them. But you know, if you're going to buy a $35 sweatshirt and you know that a portion of it is going to go for a good cause, if you're going to buy a sweatshirt anyway, you're going to buy that one.
Right. Yeah, and so that's kind of what we're trying to weigh out. Like we have to get at least 9 sold for it to even roll into the fundraising things. And we're not even necessarily looking for commitments, but if you're thinking in your head, like, I just don't really think that's going to happen, then we want to hear that now, because we really don't want to sort of chase this rabbit if it's not something that's going to be feasible. What was it? How many do we have to sell to make? Do you remember the number on that?
If they're priced at $30, we would have to sell 13.
Right.
So
if it's
a little bit
35,
higher.
we have to sell 9.
Because the other option is that it doesn't have to be a sweatshirt. It could just be a long sleeve tee or a normal t-shirt, which now that we're in January, it'll be getting warmer soon. So I don't know if anyone has an opinion on like the type.
Thoughts on that at all. Yeah.
So I was thinking, one, t-shirts are pretty popular around here, and I'm not sure how many other agencies you guys coordinate with. But one thing that's been successful with ours is being able to, if staff participate in purchasing shirts for fundraisers, then on Fridays they get to wear them. And so that might be something, if you coordinate with other agencies. T-shirts are good year round because they can pair them with a sweater. They can kind of wear them in the summer, so staff get more use out of them. But that's something I've seen just be really successful, is if you participate in this fundraiser, then you can dress more casually on Friday, and people they'll pay anything to wear a t-shirt. So that might be a thought.
Great idea. I hadn't even thought about that, but that is a wonderful idea. So we'll definitely look into that. If you know of any agencies that have like a dress code policy where that would be an incentive, let us know about that. I can think of a couple of places. But that is a great idea. And maybe then in that situation, a t-shirt would be easier. We try to be a little bit cautious with t-shirts because we've tried t-shirt fundraisers in the past and they did not go well. But that was us ordering them up front in bulk and then trying to sell them. So we are not doing that again. If we can help it, we're going to have people place their orders up front and go that way, so that we're not wasting money on that. But that is a really good idea. So we'll definitely look into that. So basically what you're saying is if someone purchases a shirt, then they can wear that shirt on like a casual Friday kind of thing. Okay, great.
Yeah, so what we do is I could find out, like for our agency, If you guys decided to do t-shirts, what we would do is we would put a sign up sheet for staff members. They would order the shirt size and prepay. And then that way there's just less of chasing people down afterwards. They prepay for it. And then once those shirts come in, they have permission to wear them on Friday. So if that's something you guys do, just let me know, and I can get find out if that's something we're able to accommodate here.
That's awesome.
Yeah, I was just gonna echo what Heather put in the chat about definitely do the pre-orders, because we found, we've done it both ways. And when everybody's like, oh, where did you get that shirt? And so you think, oh, this is going to be a great thing. And then you order all the shirts and you're like, and we still got do good shirts. And I love my do good shirt, but we're still trying to get rid of the ones that we ordered. Whereas when you do that, you just make that arrangement and people do the pre-order, which I think is what the city of Alcoa does with their shirts. It's just easier, but you may check with Cornerstone, because I know that that they've done stuff for fundraising where they could purchase shirts and then they could wear those shirts on a certain day. And so you might check with like Ann Young or Steve or somebody out there and see if that's a possibility, because this would be a great one for them to have. And you could split the difference between a t-shirt and a sweatshirt and do a long sleeve t-shirt. That's my favorite.
Me too.
Me too.
Yeah, that's a really good idea. So we'll definitely, we have some board members on right now, but we'll definitely pass all that on to our board, because I think that that's probably, Katie, the best idea that we've had with this so far. So yeah, thank you for that input, and that kind of simplifies things too, because then obviously we'll know if we're going to meet our order requirement based on whatever the pre-orders are from the agencies that we're partnering with. So great.
Yes, thank you.
Solving our problems.
All right.
So we just started, for any of you who have kind of maybe been out of the loop for a little bit or just forgotten, we picked up new contracts with the state January 1. And these were brand new contracts for us because we are now managing our own finances. So we're our own 501c3. And with that comes a lot of great things, but the other piece of that too comes a lot of responsibility, which is why you hear us talking a lot about fundraising and trying to make sure we have that discretionary money to operate our reimbursements for our grants. But so that's that piece of it. The other thing that happened when we started up our new contracts was we had a chance to redo all of our implementation plans. And so some of our implementation plans, the strategies and the goals for those had been around for quite a while. And we had a chance to sit down with a consultant from the state and really look at what was going well, what wasn't going well, some ideas to change strategies that might have a bigger impact in our community. And so we want to share some of those updates with you, because our whole goal this year for starting in January for us, and we're on a fiscal year, so we'll start a new fiscal year in July. But for the rest of this 2020 year for us, our biggest goal is finding meaningful things that our coalition members can engage in, and that everyone can have specific roles and specific asks and understand kind of what their part is in all of this. Because that was some of the feedback that we got, was that some of our longstanding members wanted to know, what can I do to be more active or more involved in the day-to-day stuff? So one of the things that we've changed is that we, when we did data collection in 2018 with our students through our student survey, some of the feedback that they gave us, which we've talked about before, was that it was extremely easy for them to purchase tobacco and alcohol products from our local retailers. And in fact, the majority of our students that were drinking underage said they got their alcohol from retailers without being carded. So they didn't have a fake ID. They just simply weren't asked for proof of age. And obviously for us, that's really concerning because it's a major access point. And we know that alcohol, when it comes to substance use, is treated the same as any other drug. So we wanted to really figure out a way to target our access points, our retail access specifically. So one of the things that our consultant suggested for us was community scans. And essentially what that would be is having our volunteers go out into retail stores with like a checklist, like a sheet that basically just observing what happens there. So is the nicotine products or vaping products on display in a certain place that's close to candy? Is alcohol easily accessible by anyone? Are you able to observe if they actually card people and ask for ID while they're there? So we'd have a specific checklist that we'd ask people to do, and we want to do this maybe quarterly. And we would also communicate pretty transparently with our retailers and say, like, we're doing this, and this isn't to be punitive. This is to make sure that you all have the things that you need from us. And if that includes more training on responsible beverage service, then we can provide that too. So it wouldn't be a punitive thing. It would really be providing more oversight to those pieces. So that was one of the things that was suggested, was doing community scans from our retailers and having coalition members that are comfortable helping us complete those as well. So that was the first thing. The second item is peer-to-peer parent trainings, and we need participation with that as well. So basically, another thing our students told us in 2018 was they weren't having conversations with their parents about the dangers of prescription drug abuse. And in fact, most of them said a parent hadn't spoken to them at all about the dangers of prescription drug abuse. One of the factors for that is the age group of parents probably didn't deal with prescription drug abuse when they were kids. That wasn't as much of a prominent issue then as it is now. And so something that we're wanting to target with that is we're wanting to train parents to then be trainers to other parents in their spheres of influence on how to talk to their children about prescription drug abuse in a meaningful way. And so we're having a training for that in January that we'll talk about in just a little bit, that we're kicking that off with. But we want to get some of your feedback on that too. Those are the two big implementation strategies that we're starting that are totally different from what we've done before. But we want to see what you all think about it, if you feel like it's doable, meaningful for us, suggestions, things like that.
I think it's a great idea. I'll be happy to help. I've got a little story of my own. I found out a couple months ago that my 12-year-old at the time had some friends in the neighborhood who were vaping. They were 11 years old. So I, freaked out and didn't go down and march down and talk to the parents right away because I was too upset. And then COVID happened again, and then it got dark by 5 o'clock. And anyway, my son came home right around New Year's and said they were outside vaping again. And my husband and I walked down to the parents' house, and they answered the door, and we said, "Hi, did you know your daughter's vaping?" And she said, "No." And it turned out she had stolen her mother's stuff, and she didn't know it. So, and she actually had the other neighbor kid there. She was watching him, and he was the other one doing it. So we had a pretty good conversation with her, and she was very embarrassed and very apologetic, and she was about ready to cut some kids' heads off, I think. But I think it just doesn't happen as often as it should, that we as parents talk to other parents about our kids. And I told her, look, we're not here to get them in trouble. If our kids were doing something wrong, I like to think that you'd come up to my house and tell me the same thing. But I was nervous to go down there, but she was great. I mean, she handled it really well. And I think that we all need to be doing that a little bit more often.
Yeah, and I think too, one of our thoughts behind all of that, thanks for sharing that, because that's exactly what we're talking about. One of our thoughts too behind training parents to then be trainers is that it's a lot easier to hear from another parent, like, yeah, I really struggle talking with my kids about this. I don't know if they listen to me. I don't know how I sound to them, versus having a professional just kind of give a lecture or whatever. We really want it to be a peer-to-peer training environment, and even having incentives with that too. So with those two new initiatives, we have some incentives that come along with that, like yard signs. So like if you're a parent participating in this, then we're going to have some signage for you just talking about, like, ask me about how to become a trainer, or things like that. So those are the two focus points for us for the rest of this year, is retail access, and then educating parents, giving parents education, and even some accountability through other parent groups. So that's kind of the thought there. Does anyone else have any thoughts or suggestions on those two changes?
Right.
Okay.
So a little bit more about what Amanda was saying with the peer-to-peer trainings. Our first one will actually be next Monday at 6:30. So Kristen Robinson, who is a licensed recovery therapist at Acadia, she will be presenting information on recognizing prescription drug misuse and how to talk to teens about it. So you'll be able to access this through Facebook Live. We'll also have a Zoom link going if that's easier for you to access. And I think the quality is typically a little bit better on Zoom, but we just wanted to have multiple different avenues. And if you're not able to make it, but you're still interested in participating, we will be recording it and uploading it to our YouTube. And so we'll send out a link through our emails and stuff like that so that you can have access to that. But yeah, we would really love it if you are able to attend, because like Amanda was saying, I think a lot of the time it's easier to digest this information if it's coming from a peer rather than just someone kind of talking at you. But Kristen is great. She has been in this industry for a long time. And so she is a wealth of knowledge. And she's actually done some videos for us before. And we had a pretty good reception to that. So we're looking forward to hearing what she has to say.
And another benefit to attending the live feed for that is that there'll be a question and answer session at the end of that. So even though we can't have an in-person training, we are going to open it up to questions from parents. And we're hoping that that'll even maybe help with some parents that are nervous about speaking out or asking things that maybe wouldn't do that in a crowd, that'll kind of open the door for that. So yeah, so that's kind of the first phase of what we're looking for, is really getting some training out there. If you work for or you're connected to a mental health care provider and you're thinking, wow, I've got a practitioner or a professional that would be great at leading some of these trainings with parents as well, please let us know, because we are partnering with Acadia right now, but we certainly want to expand that into some other providers in our area as well, just kind of for that complete care perspective. So that will be the 25th, Monday the 25th, and just stay posted because we'll send out a link for that, and that'll be 6:30 at night.
Is the library going to post that on their little scrolly thing outside?
I think so.
Okay.
I need to make sure for that. She will. So Kristen's going to come here to the library after hours, and we're going to film her using some like professional equipment just to make it a little bit easier to see and hear and all of that. So yeah, we're going to try to do our marketing through them as well.
Okay. And do we have like a little poster that I can print and just like put up in places where people might see it?
We can get some posters.
Mm-hmm.
Yeah.
I think we'll be posting the event page and like a little graphic, so we can get that sent to you as well.
Okay, thanks.
Ladies, be careful just posting the link, the Zoom link anyway. Don't just post it willy-nilly. We got Zoom bombed one meeting. We're having a meeting with kids, and these people, we put it out on Facebook, and people got on there and was playing some really raunchy, nasty stuff. So be careful with the link, actual link.
Maybe we need to ask people to sign in or something.
Yeah.
Or send it
register
to specific people. Yeah.
Mm-hmm. Yeah.
Now the Facebook Live should be okay, because you can't respond to that, or you can't get into that one.
Yeah, we are gonna do an online registration too. So if people want to register for that, we actually have it set up now where our database system that we purchased last year can manage that for us for registering for events and attending events, which is great, not just for us as sort of some bookkeeping, but also for community members that are super involved in our activities. We want to make sure at the end of the year that we can recognize them. So that's another way that we can track that information. So we'll send out an event registration for that as well. And this is kind of our first attempt at doing a specifically parent focused training, and also virtual like this. So we anticipate that we are going to probably have some things to learn from this time around. But if you do have suggestions, especially on trainers or content that you think would be super relevant, things like that, please let us know, because we definitely want to have this evolve into a regularly occurring thing for our community.
Because these topics don't have to be, oh, I'm sorry.
No, I was just going to say, I'm assuming you've already sent this out to the schools, so they can tell the parents, and we can get Blount Partnership to post it as well.
Mm-hmm. Yep.
I was just going to say that these topics, they don't have to be prescription drug related only. It can be anything in our purview. So even if it's like tobacco or something like that, we would still love to hear about that.
Mm-hmm. Yeah, we're starting with prescription drug abuse because that was the highest percentage as far as kids saying, like, my parents don't talk to me about that. So we're starting sort of with what we consider to be the greatest need and going from there. But of course, we know that includes probably other substances as well. So yeah, so there's that. Just some housekeeping things. So we're still looking for a co-chair if anyone is interested in that. And oh yeah, Hijacked is being rescheduled, and we'll keep everyone updated as soon as a new date is confirmed for that. So if you attended the Hijacked event at First United Methodist Church last year, it's kind of a big education event on opioid abuse and just addiction in general. And so that is being rescheduled. We don't have a date yet on when it's supposed to be rescheduled, but for obvious reasons, they can't hold that event in person this year, and I don't think they're trying to do that virtually. What other housekeeping items are we forgetting, Danielle? We did mention fundraising and that we have an angel donor.
Yeah, I can't think of anything.
Okay.
I mean, other than just talking about our next community event that we might want to do out after the training next week.
Mm-hmm. Yeah, we did talk about some in the spring. We do want to do another tobacco pickup event. Definitely in partnership with Keep Blount Beautiful. If you have other agencies that are doing things like that we can figure out how to collaborate with, that's what we really want to do, because we would love to tag team or even to pool resources so that we aren't building everything from the ground up with pre-existing things in the community.
I would like to do a vaping event.
Yeah, and I think probably anyone working with kids right now would feel pretty similarly, especially since so many kids are in virtual or a hybrid schedule with school right now. So we know we are concerned because of supervision and a lot of parents working and trying to figure out how to monitor that. So we are concerned about that. Do we have another slide?
Is the training post on our website already that I can forward on social media?
It hasn't been posted yet. We're about to post it this afternoon.
Yeah.
Okay.
Some of that too was just making sure, because Kristen, our trainer, got sick this week and didn't know if she was going to be back at work, but she is going to be back at work this week. So we were trying to hold off just a little bit to make sure that she was actually going to be able to do the Monday training, but she says that she should be good. The other thing that didn't make it into our presentation is student surveys. So we are set to do our 2020 student surveys. So we do them every 2 years, and that's part of our state grant. The state pays for it. They collect the data. They pay for an external agency to process it and to give us district-specific data back. And so right now we are participating in part with Maryville City Schools, their 8th grade, and then Alcoa City Schools. Blount County Schools is still on the fence right now about what they're going to be able to do. But obviously we know this is important for our community, for data, to be able to track these kids, to know what our trends are. So we just wanted to keep everyone up to date on that. Does anybody have any comments, agency announcements, things like that. Any sort of items that's going on with your agency that you'd like us to announce.
I just want to share, we're doing the homeless point in time count right now this week. So the survey is on our website. We're just doing it as a Google form. There may be some people that are doing some street outreach, but we aren't asking people specifically because of the situation to go out and do that. But we do, people can call into our office and we can fill out the survey for them as well. So it can either be a self-taken survey or an interview until tomorrow. And then we'll get all that information and data to the coalition.
And I'm sure, are you already working with the library on that?
Yes,
Okay.
I have sent the information to Casey with all of the form and the instructions. And then there's a flyer too that you may see like up on the screens, because there's a QR code that you can actually like scan it, and that takes you to the survey as well.
Great. Yeah.
Yep.
Okay.
Lisa,
Thanks,
what sort of information are you looking for?
Basically, there's only 4 questions on the survey that are required. And it's where that person is located, where they slept last night, and their age range. There's obviously additional questions as far as if they have any kind of physical or mental disability, if they are fleeing domestic violence or have any substance abuse issues, how long they may have been homeless. But the specific questions that they want to know is just where they slept. They're also this year including anybody who is living at home but expects to be evicted within the next 2 weeks as being homeless. And so that's a little different this year because of COVID. But yeah, it's just there's 4 questions that are the required questions, and then everything else is just obviously the Coalition for Homelessness uses it for their grant writing. We keep track of it as well, but we kind of just try to keep track of, single men, single women, family units. There's also like a veteran contingent. So it's just little pieces of that. And then we also, kind of try to give resources as far as, if you come across like a runaway or a family or a veteran or things like that.
What's your website?
It is unitedwayblount.org.
.org.
And it's right there at the top of the landing page.
And how long will this be going on?
We started it on Monday, and we'll probably try to wrap it up by noon on Friday.
Oh, okay.
But I mean, like if we get information like other than that, they usually just do that like this one point in time. But if you have information and you get it to us, we will. But the survey itself will probably be closed on Friday.
Thank you.
Thank you.
Thanks, Lisa. Yeah, and that is important for everyone too, because there are so many things, obviously, we know that cross coordinates with homelessness, including but not limited to substance abuse. So, so thank you for that. One last thing that I did want to mention, sorry, I just thought of this, is our COSSET grant. Some of you guys were notified, probably most of you were notified about it, and that Blount County is going to be a recipient of that grant. We've had some hold up with that because the person that was, I just learned, the person that was coordinating that grant with us and coordinating the dates for our intercept mapping sessions that we were required to do, she was killed unexpectedly last week in a car accident. So we are a little bit on standby as far as just trying to let the state get a handle on that and who they're going to have taking her place and taking that over. And obviously just kind of a really tragic thing for their department. So I did want to let you guys know, I know Katie McNabb is on the receiving end of that too. It's not something we're neglecting. We are just kind of trying to give the state a minute to figure out how they're going to proceed. But I'll hopefully have updates on that finalized date for everyone next week. So that was all from us. anybody else has anything, please feel free to chime in. Otherwise, I think that's the majority of our announcements for this week. And since we're just getting started under our new contract, next month we should have more specific updates on our implementation plans and kind of what we've been able to accomplish. But again, I just want to plug, if you feel so compelled, if you want to donate, you know, $20 this month, it's $40 for us because we have that angel donor. If you donate $50, it's $100. So it's a really great time to really maximize that. And our first goal is $10,000, and we're almost there. We're really close. So we really would love it if you're able to. You can donate on our Facebook page. You can donate on our website. Super easy. And we appreciate any and every little donation that you're able to give. So that kind of wraps it up for me. Otherwise, please reach out to us with ideas or thoughts or anything, and we will plan on seeing everyone in February. All right. Thanks, everybody.
Thank you.
Thank you.
Bye.
You guys.